Hi, my name is Prakash from Kuala Lumpur, Malaysia. I'm a transfer student from the Sunway University, Malaysia.
Hi, my name's Edwin. I'm from Kuala Lumpur, the capital city of Malaysia, and I transferred from Sunway University, Malaysia, to UK.
Could you all tell us about like your health care from early childhood to 18?
In elementary school, we got like free vaccines and free dental care, but that's all we got from the schools.
If you were to go to government school, public
Yeah.
school, you get free healthcare.
They would check for cavities and stuff. They might give you braces sometimes. Everyone has a card.
Yeah, a card that records your dental care since elementary school all the way to high school, all your records, your dental records.
So what happens when you turn 18? Then like what happens with your health care?
You could still keep the records. It'd still be in the public records, but you have to go to the general hospital, the public clinics, to get like those kind of healthcare. But you have to pay a bit more, like maybe about $10 for an appointment or something.
It depends if you were to go to government hospital, you pay a little bit, but if you go to private hospital, you pay more.
How does the quality differ between public and private?
Actually, the top specialists, all the top doctor specialists in Malaysia, it all comes from the government, not from the private.
How do they attain the more qualified people in the government healthcare? Are they paid more or?
Mara, the government sends scholars in this program called Mara to good schools. Yeah, or JPA to good schools. So they make sure they go to like good schools and the government pays for them.
It's like a
scholarship. And in return, they work for the government for 2 years.
It's
you know
like
how
a
that works?
bond.
It bonds them for 2 years.
Could you all talk to us a little bit about how healthcare providers are trained? I know you said your sister's in medical school.
The difference here is that, for example, you have pre-med. You just choose a major that's related to medical school, something like chemistry major. But if you were to study in Europe, like my sister studied in Czech Republic, she just go into the major. So usually I think from third year you're starting to choose your field.
But as far as training in the country goes, it's not that good. Like they tend to send people overseas to get their training and come back.
So if you could improve healthcare in Malaysia, what changes would you implement? Like if you could change anything?
The service, I think, because the service is bad.
Just the waits for the public care.
Yeah, just the waits. They give you proper like treatment and stuff, but just the wait. And maybe like the wards could be a bit bigger.
And it smells better or something.
Yeah.
So how old were you all when you started smoking cigarettes?
18.
Is it common for most people to start before 18?
Yeah, elementary school, high school, and some high school kids or elementary school kids, they think it's cool to smoke, so that's why they started smoking.
You can buy cigarettes in school uniform. They'll sell it to you.
They'll sell it to you.
They would open up a box and sell one for like 20 cents.
Yeah.
Didn't you say you knew someone who started smoking when they were 10 years old?
Yeah,
it's very common.
And they smoke a pack of them when they're like 12. So.
Oh wow.
You can buy cigarettes like anywhere.
Can you tell us about how the Malaysian government works to promote anti-smoking campaigns?
By putting pictures like lung cancer on the cigarette box and everything, all those gory pictures.
And they raise the tax every 6 months. So.
Every 6 months the price increases and increases and increases. It gets more expensive.
Do these campaigns deter you all from wanting to smoke cigarettes?
Nope, not at all.
They smuggle illegal cigarettes in. So the illegal cigarettes are like $1 a pack, and the regular cigarettes are like $4 a pack now. $4.
Do the illegal cigarettes have like the pictures of lung cancer on them and stuff? And are they easy to get a hold of?
Yes.
Very easy.
And they're bad for you because one of my friends, he smoked that for like 3 months, and he's been smoking for 3 years I think now, and he started bleeding, like coughing out blood and stuff.
Does it surprise you?
Not really.
Not really.
Yeah.